Okay, so if you're expecting a baby, you already know. Your social media feed is just a whirlwind of advice, right? You're hearing from family, friends, and, let's be honest, a ton of influencers and health coaches. It can be so overwhelming when all you're trying to do is figure out what's best for your baby.
And one of the very first big decisions you're going to face, sometimes literally moments after you give birth, is about the vitamin K shot. You've probably seen a bunch of conflicting posts about it, and it's so easy to get confused. So let's just take a breath and dive in and separate the real facts from all that noise.
Feeling a little uncertain about all this is completely normal. Of course you have questions. You're a parent trying to make the best, most informed choice you can. Our whole goal here is just to give you the clear, straightforward information from the actual medical research, so you can feel really confident. So, first things first, why is this even a thing? Why do newborns need vitamin K in the first place? Let's get right to the heart of the why.
It all boils down to something called vitamin K deficiency bleeding, or VKDB. The easiest way to think about it is this. Vitamin K is like the supervisor for your body's little repair crew. When there's a cut or even just a bruise, vitamin K shows up and tells the blood how to clot. Without enough of that supervisor, the crew just doesn't know what to do, and the bleeding doesn't stop.
And here's something that's so important to understand. This has nothing to do with a baby being unhealthy. Absolutely all newborns, it doesn't matter how healthy and strong they are born with super low levels of vitamin K. It happens for 3 really simple reasons. Not much of it gets from you to the baby before birth, their brand new little gut isn't ready to make its own yet, and breast milk, which is amazing for so many reasons, is just naturally very low in it. Now, this risk isn't just for the first day or two. This kind of bleeding can happen in 3 different windows. There's early, which is right at birth, classic, which is during that first week, and then there's late, and this one can happen anytime up to 6 months old. That late one, that's the one we really need to pay close attention to.
Okay, so we've got the why. The fantastic news is that the how, the way we protect our little ones, is incredibly simple and so effective.
That's it. This is literally the whole process. It's just one tiny little shot of vitamin K right in their thigh muscle, usually soon after they're born. That single shot gives them all they need to make those important blood clots, protecting them through that whole vulnerable period. It's just a simple preventative step.
And does it work? Oh yeah, the results are just staggering. Before this became routine, that classic VKD in the first week was way more common. This one little shot has basically made a life-threatening condition incredibly rare. I mean, the numbers really do speak for themselves.
Okay, so let's talk about what you're probably seeing online. A lot of the advice out there suggests waiting and seeing, or maybe just opting out altogether. So it's really important that we talk about what that choice actually means and what the potential risks really are.
And this is the question at the very heart of the debate, isn't it? If this bleeding is so rare, what are we really worried about?
The risk of that late VKDB, remember, the kind that can pop up weeks or months later, is about 1 in 15,000 for babies who don't get the shot. Now, that number might sound really small, but here's the problem. Late VKDB often strikes with absolutely no warning in a baby that seems perfectly healthy.
And here's the most crucial part. It's not about if they bleed, it's about where they bleed. With late VKDB, the most common and by far the most dangerous place for a sudden bleed isn't a little cut on their finger, it's inside their body, and most devastatingly, inside their brain. And when that happens, the consequences are just heartbreaking. Medical research shows that of the babies who have a brain bleed from late VKDB, about half will either suffer permanent brain damage or they won't survive. This right here, this is the terrible risk that the vitamin K shot is designed to completely prevent.
So let's just lay it out side by side. It's really clear. On one side, you have a baby who is protected from this. On the other, a baby who is at risk for a sudden, life-threatening emergency. The shot is just a safety net, there for them during a time when their little bodies can't make their own.
Look, at the end of the day, this is your decision. You are the parent. The whole goal here is just to help you make it with clear facts and confidence, not with fear or confusion from a bunch of conflicting social media posts.
Let's just tackle the biggest myth head on, okay? There was an old study decades ago that got pulled back, but it created this big scare about a link to cancer. But since then, years and years of modern medical studies, so many of them, have all confirmed the exact same thing. There is no link between the vitamin K shot and childhood cancers, period.
So when you're getting ready to talk with your doctor, here are the 4 things to just keep in your back pocket. 1. This affects all newborns. 2. The shot is a super safe and proven way to stop dangerous bleeding. 3. The risk of waiting it out is a sudden brain bleed that can be catastrophic. And 4, most importantly, this is a completely preventable disease.
This information we've shared, it's not just someone's opinion. It's based on decades of medical research and practice from all over the world. Our goal was just to cut through all that noise and empower you so you can have a really good, confident conversation with your healthcare team.
So, we'll leave you with this one question. In a world that is just full of opinions, what information are you going to use to protect your baby? Because what truly matters is having the clearest facts available to make the best possible choice for your family.